Now, joining us from North London is Susan Michie, Professor of Health Psychology at University College London, who says we're in a very dangerous situation. And from Bath, by Dr Bharat Pankhania, Senior Clinical Lecturer and Head of Public Health Medicine at the University of Exeter Medical School, who says we don't have the stamina for another full lockdown. Let's come to you first, Professor Susan Michie. Now, you think we're in a very serious situation here. So do you think it is absolutely right that we should be heading into some sort of lockdown in a few weeks' time? You think that's probably going to happen?
Well, I hope not, but it does depend on government strategy. We're in a situation where throughout England now, the R value is just below 1. So we are in a risky situation. We're also in a situation where over time, and over the mixed messaging we've had, and with all the opening up of different restrictions in a rather confusing way, a section of the population have become more complacent. And so just going into enclosed spaces like gyms and restaurants and pubs, we know are high-risk situations. And we don't have a clear strategy from the UK government, as we do from, for example, the Scottish government or Northern Ireland, of a zero COVID, getting this down to zero, where we can really all begin to go out, enjoy ourselves, children get back to school, workplaces open, the economy get restored. At the moment, we're in a drift situation, and we can see what's happening in Europe. We saw what was happening in Europe before this happened, before the lockdown. We did it then. Cost tens of thousands of lives, according to the modelers. And my concern is with dithering again. And if we don't change tack urgently, we may lose tens of thousands of lives again. So, zero COVID should be the strategy, as Independent Sage reports very eloquently describe how to get there. And that would be my advice now.
Dr Pankhania, whether the strategy is zero COVID or just containing the virus right now, I mean, people watching at home now, here we are, end of July, we've been in this situation 4 or 5 months now. People are watching at home are getting slightly fed up. They're hearing different messages, whether it's from the government, they're hearing lots of things coming from us as broadcasters, they're reading different things in the newspapers, different things from different medical professionals. It's a very confusing situation at the moment. How do you even make that clearer? How do you give some confidence to the public that actually there is a strategy in place, no matter what that strategy is?
I totally agree with my colleague from University College that there is a plethora of mixed messages, and this is very serious. Whilst we may get away with it in the summer months because we are mostly outdoors, now is the time, to be honest, to prepare for the autumn months. And I personally feel, just like my colleague has just said, that the autumn months we may get a bigger spike and we do not have the clear messages that we need. And the clear messages are very simple. The virus has not gone away. It is still in circulation. Please be careful. Please don't drop your guard. And all these little bits and pieces of social activities opening up are conducive to transmission of infection. Therefore, we need clearer and regular reinforced messages that don't drop your guard, be careful, the virus has not gone away, and finally, prepare. And we must start to prepare for September when the schools open, and I expect case numbers to start rising then.
And Dr Pankhania, how do you envisage the second wave will look? Because are we going to see, a gradual increase in the number of infections? Are we going to see another peak and then a fall off? Or do you think it's going to be that there will be localised pockets that will increase and they'll have to be tackled on an area-by-area basis? Yes,
I agree with you. First and foremost, I would like to say this is a continuation of the first wave. We never properly conquered the first wave. All we did was have a partial lockdown, and because of the partial lockdown, case numbers went down. Then we had the premature lifting of the lockdown, and as we've seen, the case numbers have started to go up. What I do visualize going forward is that we will have hotspots regionally. Therefore, like what we've seen in Leicester, Oldham, Manchester, York, other places, I expect to see those hotspots. Now then, what I feel we also need to start practicing, and I'm sort of very concerned that we haven't started the practicing, is local autonomy, local command and control and local experts leading on controlling this outbreak, because there will not be a national lockdown or a national strategy. So we need to start practicing the local outbreak plans now and implement them, because that's what we will have to do going forward, locally led.
Professor Michie, can I come to you on that? Because is it easier to have a full national lockdown again, to say to everybody, look, we're all joining together, we're doing this for everybody, we need to have a time where we lock down? Or is it easier to do it region by region? Because there were some feelings, weren't there, in these regional lockdowns that actually when you're looking at someone in a house a few streets away that can go out, that can live life a bit more normally, whereas you can't, that actually that makes it harder when you're not all in it together?
A national lockdown would be really bad, bad for the economy, bad for people's mental health and morale. Local lockdowns or restrictions, I think is a better word that we should use, is absolutely fine if you had to have a good test, trace and isolate system in place. However, we still don't have this. We had, I think it's the Director of Public Health from Oldham yesterday saying they still weren't getting the data on negative results. They still weren't getting the data in timely fashion. This just isn't acceptable when people's lives are dependent on it. We still don't have a good strategy for isolation. We don't have the data. We don't know how many people are isolating. We don't know that many people don't understand what's required by isolation. A lot of people seem to think isolation means you can still go out to the shops and for your daily exercise. There's no strategy to support people financially if they're missing out on work, if they're asked to isolate, either because they test positive or because they're a contact of somebody who tests positive. And indeed, their whole household is meant to isolate. There's no provision if people can't isolate in their houses because they're sharing a bedroom, for example, with other people. So the government needs to get real quickly if they are to make this system work. Unless we have this system working, we're not going to be able to get out of this situation. This is why I say we're in a highly dangerous, risky situation. Unless it's satisfactory for this government to carry on with thousands of new cases a day, hundreds of deaths every couple of weeks, most people don't think that's acceptable. Okay. All right. And most people want children to get back to school in September. At the moment, that is not looking guaranteed.
Professor Michie, thank you. Thanks for that. And thank you, Dr Pankhania. Dr Jarvis, I'll just bring you in very quickly before we wrap this up. The thing that's interesting we didn't pick up on there is that, yes, there are some high infection rates. Infection rates are going up, although we've heard that Leicester's now coming back down again. But the thing that's interesting is that they're not turning into serious cases. I was speaking to somebody yesterday who's looking into the situation in Leicester saying there aren't many serious cases and still there isn't any mortality, as much mortality as we had before. So is that a good sign or do we just do not know what's happening?
Well, we can't let our guard down, I think, as our speakers have absolutely said. I entirely agree that local lockdowns are going to, or local restrictions, Professor Michie's quite right, are the way to go. Because if you look across the whole country, we've got a rate of 15 per 100,000. In Leicester, when it was locked down, it was 135 per 100,000. It reached a peak of about 170. It's now at about 55. But what we've got to do is get local community leaders involved, making it clear to members of their population why it's happening and the fact that if you're in an area of high risk, if you make small sacrifices now, you can really help the bigger situation.
And Dr Jarvis, let's just remind everybody of the basics again, because we mentioned this earlier, didn't we? That in the end, whether you're going to work, not going to work, going on holiday, not going on holiday, popping out of the shops, everybody should be doing the very simple basics. Wash your hands regularly. We now know where you're supposed to wear a mask and not wear a mask. Yep. Tell us other things.
2 metres away if you can, and test and trace. If you've got symptoms and you have a test, you'll get the results back within 24 hours. If you're negative, as soon as you feel well, you don't need to isolate anymore. We did 350,000 tests last week and 4,000 of them were positive. The vast majority of people got a negative test and as soon as they felt better, they didn't need to isolate.
Thanks.